طيب، بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. حياكم الله جميعا. عاصم صويان معاكم من الجمعية السعودية لأمراض جراحة اللثة. أول اجتماعنا اليوم هو إن شاء الله شرح عن المنافسة أو المسابقة الكلينيكال اكسلنس أورد كومبيتيشن اللي أطلقتها الجمعية كمبادرة سواء للطلاب في الجامعات مرحلة البكالوريوس أو في الطلاب في مرحلة الدراسات العليا. معانا في الاجتماع الدكتور عبد الله العمري رئيس الجمعية السعودية لأمراض جراحة اللثة، ومعانا كذلك الدكتور عبد الكريم الحميدان استشاري أمراض جراحة اللثة من جامعة الدمام عضو هيئة التدريس، وهو إن شاء الله إنشارج على الكاتيجوري حق الأندر جراد. معانا كذلك الأسوشيت بروفيسور الدكتورة مهبة همام عضو مجلس إدارة واستشاري كونسلتنت أمراض جراحة اللثة، وشيز إن شارج فور ذا category B which is related to the postgrad. قبل ما نبدأ نسمع كلمة من الدكتور عبد الله. تفضل دكتور عبد الله. Please everyone with us, please put your mic on mute mode, please.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. حياكم الله جميعا ونرحب بكم في هذه المسابقة والتي تهدف إلى تحقيق إحدى أهداف الجمعية، وهي تعزيز العلم والمعرفة في تخصص ومجال الجمعية. وفي البداية أشكر الدكتور عاصم الصويان رئيس لجنة التعليم الإلكتروني وجميع أعضاء اللجنة على ما بذلوا للخروج بهذه المسابقة، وأتمنى من جميع الإخوان الطلاب والطالبات في جميع الكليات في المملكة العربية السعودية وفي دول العالم وأطباء حديثين التخرج، وأيضا بالنسبة للمتدربين وطلاب الدراسات العليا في جميع البرامج المشاركة في هذه المسابقة. وكما أشكر راعي هذه المسابقة على تقديمهم الدعم، وأتمنى الجميع التوفيق. شكرا لك دكتور عاصم. تفضل.
طيب، شكرا دكتور عبد الله. إن شاء الله هذه اللفتة يعني هي موجهة لجميع الطلاب وكذلك المنتسبين البوست جراد. إن شاء الله نبدأ الحديث مع الدكتور عبد الكريم. الدكتور عبد الكريم تفضل.
طيب، السلام عليكم، مساكم الله بالخير ويعطيكم العافية جميعا. اسمحوا لي I'll speak in English عشان if there is any applicants or potential applicants in the future who don't speak in Arabic they will understand.
دكتور عبد الكريم، بس اسمح لي انوه اللي عنده سؤال يا ريت يكتب في الكويشن اندر سيكشن كويشن اند انسر سيكشن تحت في اسفل الشاشه بليز. تفضل دكتور.
شكرا. طيب, so this clinical competition is basically divided into two main categories. I'll speak about category A and then Dr. Maha will help us with category B. So the aim of this competition, again, like Dr. Abdullah mentioned, it's really to help the future generation dentists and also the students, the interns, and the freshly graduate dentists. And we're really trying to help raising the bar and bringing up the dental levels to a higher level, inshallah, down the road. So the nature of this competition, it's basically a clinical based competition. So we're expected to see clinical cases. So it's not a research competition. It's a clinical competition, and categories involved in this is basically pre-doctoral students, dental interns, and general dentists. The door is open for national students in Saudi Arabia and, of course, people from outside the country to apply. And if we just for us to explain things, how does it work? What are the phases? So phase one, what you're going to do is there's a special form in which you will apply a brief description on the case, and then you're going to show some clinical photos, radiographs before and after, and periodontal chart. And then once these cases are submitted, the scientific committee will go over them, and then they will select, in their opinion, what's the top 30 applicants. Those 30 applicants will then be asked to submit their cases fully, and along with that, what proves their current standing. Meaning, if you're a student, we'd like for you to show us what proves it, either a transcript from your university, or maybe if you're a dental intern, show us your card, or if you're a graduate already, a fresh graduate, show us the certificate of graduation. Now, once these 30 cases are selected, they will be asked also to submit a consent form that will be uploaded very soon for you guys to pick up. So for now, focus on submitting your case, following that, and focus on meeting the deadline, which we'll be talking about. Now, these 30 cases, once they're selected, they will be informed, and they will be told what's the date, and then they will be competing 6 applicants per day on 5 consecutive days. So every day there will be 6 people presenting, and there will be a unanimous committee that will evaluate, and that will have some weight on the overall grade. And then part of the other is based on voting on the webinar and voting on Twitter account. So you could definitely, if you see something nice, a colleague of yours, whether it's he or she is in the university that you work at, you could definitely vote, or you can see something else nice. Of course, you can still vote. So once, and then in each day, 1 out of the 6 will be selected, and those total will be 5. They will go to the final phase, which they will be asked to present, and again, a unanimous committee will be overlooking that part, and of course, only top 3 will be selected at the end of the day. So let's go over the rules and regulations, because there are so many questions that come up every day. So you need to be an active SSP.
Okay, you can see it, Dr. Abdul Karim, now?
Yes.
So let's go back to the aim. We discussed this one. Let's, okay, from here.
Okay, so as you can see, it's a clinical-based competition, meaning we're expecting to see clinical cases, not really a research competition. We're also expecting pre-doctoral students or dental interns and general dentists, and of course the door is open for those who are from the Saudi Arabia or outside the country. Okay, let's go over the phases one more time. So phase number 1, you need to upload your photos on that specially designed form. Submit the case before the deadline, please. As you can see, it's 11th of April. Now, phase 2, Dr. Asim, can you click?
Yep.
Okay, phase 2, once we receive the applications, we're gonna filter them. And then the top 30 applications will be selected. Now, once these 30 applications are selected, they will be sent an email to notify them, to tell them. And then along with that, we would like for them to submit a few other things. These things are, send us please the presentation in a PDF format. Send us please a consent, and we will go over that as well. And send us what proves that you are either a student or a dental intern or a fresh graduate dentist. And we will talk about fresh graduate dentist, how fresh is fresh. Now, once these 30 are selected, they will be notified, their names will go out, and then they will be assigned a specific date and time, and those 30 applicants will be subdivided into 6. Every day, 6 applicants will be presenting, and those 6 applicants, every day 1 applicant will be selected to go to phase 4. Now, in this phase, the weight of the grade is basically a combination of two main elements or three main elements. The assessment committee, number one, and voting on webinar, number two, and voting on a Twitter account. Okay, so if you see something nice of any of the application, you can definitely vote again on Twitter or webinar, and this will definitely help the applicant if you think that he or she did a good job. Now, every day again, one will be selected, so these are 5 days. One will go to the final phase, making the final phase is total of 5 applicants, which is again, Dr. Asim can show us phase 4. So the final competition, 5 applicants, they will be presenting again, and unanimous committee will be giving the grades on this. So it's very fair competition, and the chance for bias is very minimal, if not eliminated at all. Moving on to the next one, please. So let's go over the rules and regulations. Again, thank you very much, Saudi Society of Periodontology, for opening the doors to for all people, all dentists, all students to become a member at no charge. Again, the dental students are encouraged to apply, dental interns as well, and a recent graduate, meaning that after the completion of the internship year, they should not be, it should not be more than 2 years after the completion of their internship. Okay, so the internship is counted as 1, and then 2 years after that, after the graduation. Okay, so it should not be more than 2 years after graduation. Okay, can we go? And of course, you need to meet the deadline, and you need to submit your case, only the PDF format, no consents yet, to the Saudi Society of Periodontology email, as you can see. And you should send those before the deadline, as you can see, 11th of April 2020. Please, anything that gets submitted after, we really cannot be accepting it because it's not fair for others. Along with the submitted case, we need the consents. And consents are basically from the student himself or herself, telling us that this is my case, and there will be a special consent sent over to those selected 30 applicants, because some of their photos might be used, some of the clinical cases might be used later on. Again, if you're showing an extra oral photos of your patient, you need to have a patient's consent. Otherwise, maybe if the case does not is of extreme importance to show the extraoral features, we understand. And the last thing, you need one signature from one of your attending faculty or clinical supervisor whom you worked with in that hospital. Someone has to sign. And then if that faculty cannot provide you for an electronic signature because of the corona situation right now, you could definitely give us the email and we could contact them and verify with them. Okay. Now let's go over the case description. The case basically has to be multidisciplinary in nature, meaning you cannot just show us a case where you just did an operative work. It has to have different specialties. And at least periodontics must be one of the included specialties. Must be one of the included specialties. Can we go one? Okay. Please, your case must be complete. And I know that the students, because of this corona situation right now, their 6th year, the last year, they might not have the chance to finish up their cases. But for those students who put a lot of effort, we tell them this is, inshallah, is intended to continue on an annual basis. So watch what your senior interns or fresh graduate dentists is doing this year, and then save, unless if you have a completed case reaching to phase 4, then yes, I encourage you to apply. Now, Dr. Asim and Dr. Mazin spent a lot of time and put a lot of effort in explaining the new periodontal classification system. And we advise that you guys use that system. please, please, please work on adult or permanent dentition, unless if you have a retained one primary tooth that you're planning to change, or with an implant or an FPD or a partial denture. We understand, but the case has to have a permanent dentition, okay? For that perio, biofilm-induced gingivitis is not acceptable. And you need to show us a little bit more, because periodontology is a lot more than treating biofilm-induced gingivitis. So let's see what the perio specialty includes for the cases. You can show us basically non-surgical therapy in the form of scaling and root surface debridement, or if you have that along with other surgical perio, such as pocket reduction procedures, resective procedures like crown lengthening, regenerative like GTR, GBR, or soft tissue maybe, or even implant surgery, you are also advised to use that. Let's see, what are the photos? What do you need to submit? What's the minimum? Let's just say, of course, when you submit your case for the initial evaluation and filtration, the case must have photos of the front MIP with the patient retracted lips showing the teeth and maximum intercuspation, and of course lateral MIPs, lateral views of the teeth where the teeth are in occlusion, and of course occlusal views of the maxillary and mandibular arch. And you need to show this as a pre and post operative. Radiographs, please show us pre-operative radiographs, and in the form of panoramics, PAs, and butt wings. And sometimes if the case does not mandate that you do a full mouth set of periapical radiographs, because you just worked on a specific area and the patient's periodontally stable, you don't need to do not a lot of caries, and your mentors or your supervisors ask you to take a selective radiographs because of radiation issues and so forth. We understand that. So you don't have to show us a lot, you don't have to expose your patients to a lot of radiation, okay? If you're doing a lot of prosthetics, in your case, we need to see casts. And you don't, obviously, we're not going to have the cast in our hands because of the situation, but at least take photos for that cast. And I'm sure most of our students inside and outside the country are doing that, inshallah, okay? Use the electronic periodontal chart. And the reason behind this is, it's very easy for us and for you to show us the charting that you've done. And for a perio chart, we need to see probing depths, bleeding on probing, plaque index. If you have charted that, it would be great, and it will tell us a lot about your patient compliance, gingival recession, attachment loss, and if the case is advanced periodontitis, then I'm sure you've charted furcation and mobility. So if you have this information, we would really appreciate seeing it. When you present later on, when you're asked, when you become one of those 30 selected applicants, show us please 2 treatment options. Show us 2 treatment options and tell us what's the ideal option in your opinion. Now, for example, if the patient ideally would be restored, he has a first molar missing, and ideally he would be restored with dental implants, no problems. But the patient, for any reason, socioeconomically or health-wise, could not go for it. But at least tell us, have at least ideal option and alternative option. This is just for people who don't know or where can they get the electronic periodontal chart. This is the website, www.periodontalchart-online.com/UK. And you can download this, but heads up, you need to have Google Chrome. If you're using a Mac, you need to have a Google Chrome to be able to download this electronic. And it's very nice and very handy. I'd advise that you guys work with it, okay? Now, final assessment, what do we look for? What does the committee, in your opinion, look for? If you're using the new classification, for example, the perio classification, you need to state the complexity, the stage, and so forth. You can't give us half diagnosis, okay? So the diagnosis must be complete and accurate, okay? And then the other thing is, Dr. Hassan, can you click? You need to have proper documentation. Do your very best. We know taking good, clean photos is not an easy job. We understand this, but you know, try your very best. You need to have to present a complete case moving to phase 4. You need to have the proper sequencing of the treatment plan. Okay, you cannot state that you're going to do surgery after prosto, because it's the other way around. Quality of treatment, of course, we understand that some steps are basically done by your senior resident or maybe your faculty member. So we don't judge you based on this, but we do judge. But if you're doing a class 2, for example, restoration, you know, try to show us a really good restoration, at least on the bite wing, for example, no open margins, no overhangs, and so forth. Complexity of the case, obviously, if someone worked on a single molar, did a root canal, post and core, crown lengthening, and then crown, is not similar to someone who worked on the, for example, who did 2 quadrants of crowns and restorative work. If you're encouraged to implement evidence-based. If you have a reference, you don't need to show us the article and explain the article and spend time explaining the article. But if you have a reference here and there, an updated reference, we do encourage that you practice, you have an evidence-based practice, okay? Presentation skills towards the end when you present, of course, how neat, how nice your presentation, understandable in fashion. All of this will make easier for the audience and for the assessment committee to make up their minds, okay? Critical thinking, the final presentation, the final phase 4, you may be asked a question, and not to embarrass you, it's just because you guys you were filtered and you guys are the best of the best. So it might be even harder for the selection committee to make up their mind. So if they throw a question here or there about perio or maybe something outside perio, it's not to embarrass you, it's just to get the best out of you, okay? Now, let's talk about the awards. So you will be getting, of course, a certificate of appreciation for the hard work that you've done. And of course, the Saudi Society of Periodontology, and thank you, the president, will be awarding you with one free membership year for the Saudi Society after the existing free membership that's open for everyone. And then of course there will be some monetary prizes. First rank will be awarded 5,000 riyals, second will be 3,000, and the third will be given 1,500 riyals. And of course the first rank, will be given a chance to present in one of the SSP main events, and their case might be published in the SSP newsletter, which is a big thing really, and a good thing to start having your work out there. So where to start? Now, you don't know what to do first. First of all, go look up your case, see if your case matches, and if you can upload that form and then send out the case. And then fill out the submission format and send it. And please, please, please send it prior to the deadline. And then maybe start bugging your faculty. Or one faculty only is needed to tell them that you're going to send that case, and you might be contacted or you might be asked for a signature. Just before we go to category B with Dr. Maha, I just want to advise, it's really a good competition, very fair. The scientific committee are very concerned to give you the best of the best, being very fair. There's no embarrassment. There's no, don't say, oh, my case is not really artistic. You never know what the scientific committee and the selection committee will pick. We know that advanced case, most of it is done by, if it's done by your senior faculty, it's not really what we're looking for, but we do wish that all of you guys apply. And it's really good competition, and it will be done on an annual basis. So for those who did not yet finish their cases, and they're waiting for healing, for example, or to place some in their crowns. Watch what's going to be done this year, and then inshallah next year you will have a better chance.
Okay.
Now moving on to category B with Dr. Mahan, Dr. Asim.
طيب دكتور عبد الكريم بس please for the audience if you have a question related to part A or category A please specify. عبد الكريم there is Dr. عبد الكريم Sarah Al-Arifan is saying that the form in the website has no period chart section. So
Yes.
we will make sure that I mean you have to attach the period charting as Dr. Abdul Karim said, or show you the link to the website, then you can attach it to the template that is available online.
Make it as a PDF format, please. Make it as a PDF format. Save as PDF and then send it. And then the period chart, pre and post, attach them and send them over.
Okay. In phase 3, Dr. Abdul Karim, 50% of the score will be awarded by, who's saying, by the committee, 50 based on voting. I think 50 is a large percentage to be based on voting. It will be more like a popularity contest.
This is true. This is true. If someone has a lot of friends, he might be lucky on this versus someone who worked really hard. I understand. But keep in mind that the first 30 who are selected, we don't look at the names. We don't look at any of this. We will try to come up with a way to mask the names, and then the cases are given to those who will select to make sure that the selection is not based on the name or university or any of this. And I will make sure that this doesn't happen. So the selected 30 are going to be really good. Now, the selection committee has 50%. I don't know, Dr. Asim, what do you think? I think it's a good weight.
The way how it's going to be delivered, as Dr. Abdul Karim said, when you present, you will not present with your name. You just present as anonymous candidates or contestant, and even the evaluator will not know your name, and the audience, of course, the close friends will know you, but the rest of them will not actually recognize you. So the evaluation will just go to the clinical case itself, not to the name. And this is just a way to go. This is the first time, so let's go with this. Then we'll see. And this is just limited for phase 3. Phase 4 will not discuss this now. Okay.
Yes.
Another question about the presentation. Yes, we'll try to upload the presentation on the YouTube, so it will be available for you. You can go back to the YouTube when we post it, and you can revise everything. أنا طالبة امتياز وعندي كم سؤال. اللي فهمته بالنسبة للإرسال المطلوب في الPDF لازم يكون على الفورم المرسل كبداية للفرز الأولي صح؟ ولا نرسل جميع المتطلبات كاملة بالتفصيل مرة واحدة؟
No, what you're going to be sending للشخص اللي سأل السؤال, you will be sending photos, radiographs, طبعا الphotos pre and post, radiographs pre and post. Again, if you did not take a full mouth radiographs, because the case does not need a full mouth of radiographs because it's too much radiation for a patient. We understand. If you've done only selective, but at least please, for those who are going to share radiographs, share diagnostic radiographs. Overlapping too much. If you did a very nice root canal, for example, and you're not showing us or the selection committee, the apex, we really can't make a decision. You know what I mean? So share pre and post, and then period chart pre and post. Yani this will only take about 4 pages. Save as PDF and then send it. Once the case is selected, you will be sent an email. The email will ask you for more details. More details, consent, proof, if you're a student, intern, or a graduate, and so forth.
دكتور عبد الكريم, بالنسبة للكونسنت يعني نفس الكومنت اللي احنا we discussed انه sometimes it will be hard to get the patient consent now from the patient's file because of this COVID-19 situation. طيب أنا بجاوب هذا السؤال بعد إذنك. بالنسبة لموافقة المريض إن شاء الله إذا اللي يقدم الآن غير ما هي مطلوبة لما تترشح للمرحلة الثانية we will find a way يعني how to get the consent حق المريض. ف don't worry now, just submit your case واذا كنت ان شاء الله من ال 30 المرشحين للمنافسه الى المرحله الثانيه we will discuss how you can get the consent form. ممكن by then the situation will be different. Dr. Muad Naqbi asking if I finished all my phases until phase 4 and only half of the prosthetic was planned to be done, but COVID just came over. Can I apply?
Okay, Dr. Muad, I'm very sorry. And I don't want to do this, but the reality is there will be other cases that will be submitted with the final crown cementation. And we might look over the case, send it over, but priority for those who reached phase 4.
Muad, also I will say, if you said I finished all my phases until phase 4, but not the whole prosthetic, that means you did not reach phase 4 to begin with. So I will encourage you to finish the case if possible. If not, you still have the chance to apply next year with the same case. No worries if we're not accepted this time. So you still have chance, whether this year or next year, but to have a fair competition, please try to submit completed cases. My case have resto endo pros, but simple gingivitis only. Is it okay? No, we said clearly it has to be more than simple or plaque-induced gingivitis. So the perio has to be a major component of your treatment, of the delivered treatment or your case. So we will move now to the second part. Dr. Maha. Dr. Abdul Karim, please go mute.
السلام عليكم، حياكم الله جميعا. صوتي واضح؟
Yes.
يعطيك العافية دكتور عاصم، يعطيك العافية دكتور عبد الكريم. You make my job easy. So we are here today to answer questions regarding the competition. زي ما تفضلوا الزملاء إنه the SSP is encouraging and promoting excellence in skills and knowledge. So we really want to raise the standards of education, improving skills, professionalism, and of course the most important is patient care. So this competition, اللي هي category B, is for the perio residents and newly graduates. Newly graduates up to 3 years after graduation. Okay, next please. Again, competition phases, as Dr. Abdul Karim explained, it's gonna be into 4 phases. So phase 1 اللي هي الحين لازم تركزوا عليها case submission بالPDF format that is uploaded على الويب سايت حق الجمعية. Deadline is 31st of April وما حنقبل أي حالات بعد كده. Phase 2 حيكون هذه الحالات it will be filtered and we will select the top 30 applicants. هدول التوب 30 applicants حيدخلوا في منافسة على 6 webinars. So ال 30 حيكون في 6 webinars و out of each webinar there will be عفوا so 30 applicants. في كل ويبينار حيكون في معليش دكتور give me a chance معليش I'm sorry I'm confusing you. So 30 applicants okay من بعد الفلتريشن حيكون في 5 ويبينارز صح؟ فيهم 6 randomly selected applicants. I'm sorry.
Yes.
Sorry. So 5 webinars. في كل ويبينار 6 applicant حيقدموا and في كل ويبينار there will be 1 finalist. هذا الفايناليست حيدخل في الترشيح النهائي. بالنسبة لفيز 3 في هذا الويبينار حيكون في تصويت during the webinar itself for the attendees وكمان حيكون في evaluation من البانل اللي حيكون معانا إن شاء الله. So out of this phase okay, حيكون عندنا 5 finalists, top 5, they will compete in the final stage and one of these 5 will be the top يعني winner, first and second and third winners. Next please. Again, rules and regulations pretty much similar to category A. So the applicant has to be يعني member in the society. Again, membership مفتوحة إلى الآن for free. Participant must be either a current periodontal resident, يعني يا إما resident in a residency program or recently graduated. اوكي recently graduated احنا حاسبينها 3 سنين من بعد التخرج، يعني اقدم واحد يكون graduates of 2017. Cases must be submitted على هذا الايميل, and again please consider this deadline not to send anything afterward because it's not gonna be considered. Next please. في موضوع الكونسنت. سو بعد الفلتريشن الاولى حيطلب بعض الطلبات منها الكونسنت انه هذه الحاله حقتك. consent of the patient also we need to ask for proof of status, يعني اذا انت current resident or freshly graduate, just to be sure that about the eligibility of you to participate in this competition. Next please. Case description. So cases لازم تكون يعني either multidisciplinary treatment, at least 2 disciplines including periodontics, or comprehensive perio case with multiple surgical interventions. Okay, cases with full arch implant is only accepted if done with surgical adjunctive procedure. إيش يعني؟ يعني لو جات حالة مثلا وتحتاج clearance وبعدين guided implant surgery وبعدين we send the patient for prosthetic, I don't think this is not going to be accepted. بس لو في similar case that need clearance and then maybe site augmentation, whether GBR or like sinus lift, يعني فيها some perio treatment and then implant بعدين prosthetic, yes, it's acceptable. Okay, again, submitted cases must be completed. Completed يعني واصلة phase 4. You don't have really to, يعني ما حنكون very critical about يعني to show us the data of maintenance phase. بس لازم تكون مخلصة up to phase 4. Okay, participant must use the updated periodontal diagnosis classification system اللي هو current classification of peri and peri-implant diseases and condition, and I think يعني this is what we are doing in our residency program here in the Kingdom and in all accredited programs worldwide. Next please. Case description. Again هنا طبعا احنا it's on a specialty level, so biofilm induced gingivitis will not be accepted as a treatment under periodontics discipline. Periodontal specialty, in addition to non-surgical therapy as scaling and root surface debridement, must include surgical treatments such as pocket reduction surgery, resective, regenerative, soft tissue plastic, or implant surgery. يعني إحنا من جد إحنا we are teeth savers احنا البيريدونتس, so we want to see the beauty of our perio surgery and يعني how do you implement these in saving teeth. Next please. Okay, بالنسبة لل requirements, a minimum of pre and post operative photographs. Okay, and of course طبعا we need supplemented photographs for surgical steps, for instance for certain procedure. يعني في كل procedure, yeah, we need surgical steps, and if there is like specific challenges during the follow-up, we also need to see these challenges because it might influence the treatment plan as well. Next. بالنسبة للبري and طبعا حنحتاج pre and selective post-operative radiograph is required. يعني pre is mandatory والselective post-operative زي ما تفضل الدكتور عبد الكريم انه let's say مثلا احنا عملنا GBR مثلا, we need to see what happened in the bone عشان we further treatment plan our case. Okay. اوكي مثلا لو الحالة فيها prosthetic work طبعا we need photos of the articulated diagnostics and stuff إذا تحتاج والواكس up and stuff. طبعا هي it depends كل حالة ولها معطياتها. Case description, so participants are also encouraged to use electronic periodontal chart. Okay, and to show these components اللي احنا متعودين عليها: propping depth, POP, plaque index, gingival recession, clinical attachment level, furcation, mobility, fremitus. Okay, next please. Okay, وطبعا when we present the treatment plan, we start with the ideal. اوكي واذا حصل في يعني احنا ما مشينا عليها لسبب او لاخر socio-economic or you know you have to show الالترناتيف اللي انت مشيتي عليها بس but you have to show the ideal at first. Next please. Participants are advised to include scientific evidence. يعني احنا it's like a plus scientific evidence to support the treatment provided. Okay, this is an example of online provided handy, easy electronic chart. Okay, طبعا هذه الدكتور عبد الكريم الله يعطيه العافية تطرق لها in details إنه evaluation is gonna be على complexity, skills, organization, clarity. So maybe Dr. عاصم you can skim or skip this. اوكي بالنسبة للأوردز طبعا حيكون في certificates وحيكون في prize للfirst and second and third as it says here. وفي هنا maybe we will يعني دكتور عبد الكريم قالها بس it's not added here إنه the winners yes thank you will have the chance to present in one of the SSP events and publish the case in the newsletter of the society. So where to start? So I'm encouraging everyone to go back and read thoroughly in details the document and the eligibility part بالذات. Okay, وبعد كده أشوف which of my cases that that I could participate to it. خلصنا كده final case submission format. Okay, and just put the pictures and everything in the PDF format provided. وإن شاء الله أتمنى التوفيق للجميع yeah
طيب.
please sure.
طيب خلينا ناخذ a few questions قبل ما نقفل. I have a suggestion which regarding category A دكتور عبد الكريم. Which is reducing the percentage voting to 20%. I think this is up to the committee decision. So please don't try to make suggestion like this. طيب I'm fresh grad. دكتور عبد الكريم قال category 1 تقبل. يا أخي I wouldn't read the question written in this language. Please write it in English or full Arabic. Good evening for all. Is there a specific format for the presentation or just follow the steps? Is the extra oral pictures mandatory?
Extra oral photos can be used and they are very important if the case has the facial characteristic features. It plays a role in the diagnosis and the treatment that you provided.
يعني let me give Dr. Abdul Karim an example. If you have patient with gummy smile and you did something to alter the appearance of this gingival display, definitely need extra oral photos. If you have a treatment with implant supported prosthesis that will enter the patient profile in the maxilla, this is definitely needed. So it depends on the case. If you have to support your application, better. If you don't, we will be the judge to evaluate if necessary or not. طبعا الفورمات موجود على الويب سايت, so just go back to the website and follow the same PDF.
If I may say something, هذه الانونيمس attendee هي بتقول أنا حشارك في مجموعة الأندرجراد والحالة فيها بيريو سيرجري ولكن مو أنا اللي عملت السيرجري. أنا حولت الحالة للسيرجري وبعدين أنا كملت كل شيء. الحالة كاملة وخلصتها، أقدر أشارك فيها دكتور عبد الكريم؟
Yes, you can.
يعني maybe you want to elaborate on this.
Yes, يعني as we said, there are certain procedures that cannot be done at your level. إن شاء الله كلكم تتخرجون وكلكم يعني you become clinically experienced. But for now, as a student level, there are certain procedures are meant to be done by residents or specialist level. So one of which is the crown lengthening. We don't expect you guys, the students, to do the crown lengthening, but we would like to see what happened after the crown lengthening. We'd like to see the nice crown. We'd like to see the nice root canal, for example, and so forth. Things that you did with your own hand. And if you have supplemental photos that could add value to your presentation, if you're selected to the 30 finalists, yeah, this will help.
طيب سؤال دكتور عبد الكريم.
معليش بس if you also يعني stress on نظافة الشغل وإنه ما يكون في heterogenic dentistry في temporary temporary cement في temporary crowns and these things, لأنه هذه أعتقد يعني يعني it's negatively affecting البيريدونشيوم. فهذا مهم بالنسبة للجونيور competition.
For people who are listening, again, we accept multidisciplinary, but remember, this is Saudi Society of Periodontology, and we'd like to see a nice periodontal status. Okay.
Dr. Abdul Karim, do we consider single implant as a perio procedure, as a perio case?
The question is, who did the implant?
I would say no, because obviously it has to be something perio disease, not just implant. Single implant is not considered as a perio discipline among the 3 disciplines. So pay attention, please. I'm sure you have cases that has some sort of periodontitis and needs replacement of teeth with 1 or 2 endo. This is the most suitable cases that you can apply.
I would like to add a small point, Dr. Asim, for that person who sent this question. If that's the only case, I will not tell you no, don't apply, no. Submit it, but priorities, like Dr. Asim said, will be given to periodontitis. If you have a scaling and root surface debridement, that's good.
Yeah, بعد إذنك دكتور عبد الكريم. So again, scaling and root surface debridement يعني الحالة مش biofilm induced gingivitis, لا الحالة periodontitis but have deep pocket. بس good job في phase 1 non-surgical في phase 1 okay خلت البوكيتس تكون مثلا كلها less than 5 معناته non-surgical. This is accepted. معلش دكتور بس هذا very
yes,
important.
no, that's a very good point, Dr.
Yeah,
Thank you.
Very important for their level. شكرا.
طيب, do we have any further question from the audience? I will give you 30 seconds to reconsider. So if you have anything, this is your chance. Dr. Abdul Karim and Dr. Ma will not take questions and private messages about this. You have to contact SSP.
Yes.
So I think there is no more question. Good luck, everyone. Inshallah, we're looking forward. I have to make an announcement. We so far received almost 25 cases. So yeah, so don't think there is no applicants. There is applicants applying, and there is a high chance for you to win. So just go find a case that fit, and you feel that it's suitable for the competition. If you feel there is a few points missing, work in the case. You have still opportunity for the next year. This is going to be annual competition, inshallah. طيب. We have to close the session. I will thank you, Dr. Abdul Karim.
Thank you, Dr. Asim.
Thank you.
Thank you.
Dr. Abdullah, I think he left already. Thank you, Dr. Abdullah.
يعطيكم العافية.
اليوم ان شاء الله نشوفكم الساعه 7 في برزنتيشن ان شاء الله حق الاونلاين، واتمنى للجميع التوفيق. يلا شكرا.
شكرا.